You're watching 8 News Now at 5 with Paula Francis and Dave Crevassier. The news of Southern Nevada is now.
Local health officials say the recent spike in influenza cases is leading to major overcrowding in local emergency rooms. Earlier this week, 7 hospitals, including UMC, declared a state of internal disaster, and ambulances were forced to go to other medical facilities due to a lack of beds. Petrania Poonswan is live at UMC with more on why patients, especially those with the flu, should not overlook urgent care clinics, especially right now.
Paula, UMC does have a number of quick care facilities around the valley, but others have popped up in recent years to offer faster and often cheaper services. But many people, especially those with flu-like symptoms, are still flocking here to the ER, adding to the overcrowding this busy flu season. In the emergency department at UMC, doctors have been busy for weeks with patients coming in with the flu or flu-like symptoms.
We've seen a gigantic peak just at the break of the new year.
ER physician Dr. Devin Moore says there are days when beds are maxed out and waiting rooms packed, even though some patients may not be as sick as others.
Everyone that comes here may not have what we consider a true emergency, but in their mind it may be an emergency.
This week, the Southern Nevada Health District is asking the public not to flood local ERs if they can, and instead stop by urgent care like this one run by healthcare partners.
Right here it looks very well. There's no infiltrates that we see.
Dr. Rakesh Kalra says his clinic is also filling up as flu season is reaching its peak. This, he says, not just because ERs are too busy, but not enough primary care doctors are out there to go around, especially as more people are signing up for health insurance.
There's a lot of problem with access, especially when they can't see their primary care or when they don't have a primary care. Dr. Carl says there are patients who choose the ER thinking their insurance does not cover urgent care, and he says that's not the case, and his clinic offers most services an ER does. We definitely do not turn patients away. Whoever comes, we'll definitely be happy to see them and help them get better.
There's a group of patients who probably don't even need to come to the emergency room.
Back at UMC, doctors say for those at risk of complications from the flu, like the elderly and the very young, do come in, but expect a busy place, especially over the next few months. And it's been a rough flu season so far. More than 1,000 people have died since the beginning of flu season across the country, including 2 right here in Southern Nevada. UMC, by the way, is no longer in an internal disaster state, but health officials say that could change at any time. For now, reporting live at UMC, Petrania Poonswan, 8 News Now.
Thanks, Petrania. And to help with some of the overcrowding, the health district has come up with a quick list of when you should go to the emergency room if you're suffering from uncontrollable bleeding, a head injury, broken bones. Don't hesitate to visit the ER at the hospital. Also, things like loss of consciousness, major burns, intense pain, or a severe reaction to an insect bite, medication, or food. On the other hand, there are certain injuries that can be cared for at an urgent care clinic. Things like colds, coughs, and flu can be cared for by urgent care centers.